Welcome back to Body Beautiful. We've been talking with Dr. Joseph Mele about breast implants and some of the latest ones that have been approved now by the FDA. In fact, in the last couple of months, so this is brand new. Let's jump right into the phone lines. We've got Deborah from Oakland. Deborah, do you have a question for Dr. Mele? Hi, Deborah, you're on the air.
Hi.
Hi.
Yes, my question is, I'm having a question about lifting the breast.
Okay.
And my question is, how do you lift a size 36 BD?
How do I lift? Very carefully. You know, there are different ways to do lifts, but as the breasts get larger, sometimes we need to do more in order to keep them into the position that we like. Because if you're already a double D and we do a lift, the forces that cause the breast to sag in the first place are still there. So it can sag again. So usually we try to kind of overdo it or get it lifted as much as we possibly can. Sometimes it's a good idea in that situation, if the patient's amenable, and you need to be amenable, is to reduce the breast a little bit to give a little more longevity to that lift, because the weight really does make a difference.
So doctor, do you recommend if someone has, I mean, not just in terms of the breast size, but weight to lose as well, that you do that first because things will shift, you know, afterwards?
If a woman is trying to lose weight, it's probably good to let that sort of sort out, because the breast can be very sensitive to weight, and it's hugely variable. There are some women who just will lose weight everywhere except their breasts, and there are some who lose it all from the breast. And you kind of want to have a stable platform before changing things, because if we change it and get it perfect and then the weight is lost and then the volume is lost, you're probably not going to be as happy with that.
And thank you, Deborah. I'm sorry, Deborah from Oakland.
That's a good question.
So what about, let's say if you want a lift, but you want to size up, I mean, sometimes you do things in conjunction.
Yes.
You'll add an implant and do a lift?
Absolutely. And they're sort of two independent factors. The volume is one and the shape is another. And the lifts give us a little more control over shape and location of the breast, whereas the volume pretty much just changes the volume of the breast.
I mean, is
so
there
when you hear people saying, oh, we'll put an implant in and that will do a lift, it won't do a lift. You can't lift the breast by just adding volume, but you can add support to the breast.
See, yeah, that was my next question. Whether the volume, how did you know? You read my mind. But I mean, whether you can just take care of it that way so that the volume would kind of just give it the boost that it lost after childbirth.
It's a very common question, and there are some people where that will work for. They have something called pseudotosis, which is false sagging. So they don't really have sagging, the nipple's in the proper position, but the breast has kind of collapsed underneath it. And by adding volume, you give back that support, and it gives the appearance of a lift, but they weren't someone who really needed a true lift beforehand.
Okay, for someone who is curious and interested and they want an assessment, I mean, how do they do a consultation? Where do you start?
I mean, the internet has lots of great information, but you really can't know what's going to be the best result until you see someone who does this. So you want to see a board-certified plastic surgeon who has experience with breast surgery, and let them give you an opinion in terms of maybe not what size you should be, but certainly what approach maybe will work best, what implants will work best, what profiles may work best, because they will have more information and an advantage because they know where you're starting from. You can give them a great idea where they want to get to, where you want to get to, then your surgeon can help figure out the best method.
Okay, we talked a little bit about size, or a lot about size. We didn't really talk about, you mentioned something about viscosity, really, which translates into, does it feel real, or is it,
sure.
You know, saline is like water.
Saline is like
Gummy
water.
is
so
closer?
the bags of saline tend to feel a little bit more firm. They rely more on pressure for their shape. We can sometimes feel wrinkles in them a little more easily, but you can feel them in the gel implants once in a while too. Really, the ideal way to not feel an implant is to have enough soft tissue, breast tissue, to cover an implant. But for someone who's an A cup, it's going to be a problem. And I think out of the two, the gel tend to feel better. They tend to feel softer. My patients who've had both tend to prefer the way that the gel feels.
Okay. And also, just in terms of really quick, the popularity, are people wanting larger, or are they sort of sizing down?
You know, it's always that C seems to be the hill, so people are happier on the other side of the hill. So if my reductions want to be smaller than a C, my augmentations want to be C+, sometimes a D. But that tends to be the hill.
Okay. Doctor, always a pleasure, and certainly great information, and especially with the new developments out there. We are out of time, unfortunately, but for more information about Dr. Mele, you can call him at 925-943-6353, or check him out at the web at either drmele.com, sanfranciscobreast.com, or at sanfranciscoplasticsurgeryblog.com. Thank you so much for joining us. Have a great day, everybody. Bye-bye.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.